Patient Yolanda Gonzalez, date of birth March 18th, 1985, is here today for a red eye.
Hi, Yolanda. It's good to see you today.
You too.
I know you're here for a red eye.
This is very exciting new technology. We call it Dragon Ambient Experience, or DAX. And what it allows the physician to do is just have a regular visit with the patient, but instead of needing to turn and type on the computer is listening the whole time. At the end of the visit, this data is sent off into the cloud and processed by computers through artificial intelligence.
The technology is very easy to use. There is an app that you can put on your own smartphone, or in this case, I'm using a Scripps issued device. I may have a patient who comes in with one problem, a same-day acute care visit, and it goes very seamlessly into the note, and then I'm completely finished with the entire encounter. On the other hand, I may have a patient with 10 medical issues, and I can delineate each of those issues during the visit. And what's also really nice is I can summarize them, which helps to summarize the visit for the transcription, and it also helps the patient. The patient also has expressed appreciation for a summary of the entire visit, of each problem we're addressing, what we're doing for that problem to close the visit. So that saves me a lot of time in dictating the entire note after the patient leaves, and then I can add on an extra patient maybe for an acute care problem that I previously may not have had time to do. It is actually very exciting to be a part of this. When I go back and see how well the note is populated and how accurate it is, and how much it mirrors my own note without adding time to my day and actually giving me time back, it's been a game changer.
Scripps is a leader in this. We are the first bringing it to San Diego County. Right now we're in a pilot phase, and we're selecting ambulatory physicians that are in many different areas: primary care, surgical specialties, medical specialties. We hope to expand to any physician in the ambulatory space that would benefit from this technology.
This is Luz Martinez. Date of birth is December 4th, 1974. She's here for her right index finger.
Oh.
Hi,
How you
Dr. Shaw.
doing?
Great, and yourself?
Good, thank you. So we're using this dictation app for our notes. Would it be all right if my phone is up for that?
Absolutely.
Thank you.
Patients are actually pretty excited about it. I feel that they like the fact that we at Scripps are at the cutting edge of technology. And a lot of them actually appreciate the fact that it'll cut a lot of work for me on the back end when I'm dictating, writing notes, and make my life easier.
So my advice for physicians who are just starting this is that you have to rethink of what you say during a patient encounter and working on some templates that might make your life easier down the line. What I mean by this is you want to say out loud everything you're doing as far as the physical exam, even a little bit of the history. You want to repeat what the patient says, because if you think of yourself as the reviewer on the Dragon side listening to the audio, they don't have a lot of context. So if you reframe what the patient's telling you, oh, so your right index finger hurts, instead of, oh, my finger hurts, with them pointing to their index finger, that makes a huge difference. I can't emphasize enough the importance of setting up a lot of templates. All I had to do was ask Dragon to insert a template for my exam or insert a plan for a specific issue I was dealing with, and that made the note quality a lot better. So a lot of time is saved, and that can open up more time for you to see more patients, or spend time with your family. Improves your quality of life. The amount of time you're spending doing work outside of work, that goes down. It helps with burnout. You think about work less because you know the notes are going to be there and you just have to sign off on it.
The average physician at Scripps is spending 52 minutes a day just typing or doing documentation in the electronic medical record. This opens up that time to do other things such as messages, seeing an extra patient or two. This is not just for physicians. The patients are actually starting to see the benefit of this. Seeing that physician sit down with them, face to face, talking to them. It always comes back to patient care. I mean, everything I look at is, does this enhance patient care? And this absolutely does.
I'll see you soon.
Thank you.
No problem.